All right. Thanks, everybody, for joining us today. Appreciate you taking time to hear more about our ALICE report and the children and families that are impacted by that. My name is Chris Sargent. I'm the CEO for United Way of South Central Michigan. And I'd like to highlight that our United Way as of April 1st became a bigger region. So you'll see the counties that we serve there. We really brought the power of 3 legacy United Ways, which included Capital Area United Way up in Lansing, Michigan, Clinton, Ingham, and Eaton, along with Battle Creek, Kalamazoo, serving Calhoun and Kalamazoo counties, and United Way of Jackson County in Jackson, Michigan, to really talk about how we could impact our local communities more than we've ever been able to do individually now with the power of the collective merger. Today's virtual event actually is the first time that we've brought a regional group of folks together to talk about this really important topic that I know we all care about. Want to highlight that we'll be sharing some more specifics about the data that really illustrates financially struggling households in our 6-county region, the impact and the challenges that that presents for children and people with disabilities. And so we're going to be able to go a little bit deeper on what the data means, how it impacts our community, and what it is that we can do about it and are doing about it at United Way with so many of our partners. Actually, many of you are on the call. So we have donors and key volunteer leaders, nonprofit partners who work every day to positively impact the outcomes for children and families that are part of the ALICE population when we talk about that in a minute. The other thing that we're going to do is we're going to have a time a little later in the meeting to open it up for dialogue. We want to hear from you. We want to hear your questions, your thoughts, your perspectives, your ideas for how we can continue to positively impact the community. So get ready for that. And I would offer a couple of quick housekeeping items as we get started. One is this session is equipped for live captioning. So you should have a button on your screen that allows you to enable live captioning. So feel free to utilize that tool and resource if it's helpful. We're also going to send the slides to all of you that have attended and registered for today's conversation. So you'll get that following today's meeting. And then we're going to ask you to just kind of hold your questions, if you would, to the Q&A a little bit later in the program. You'll have an opportunity to raise your hand and come off mute or to put questions, thoughts, and perspectives in the chat box. So I just wanted to welcome you for today. Thank you for taking time, and thank you for being with us. And now I get the pleasure of introducing Alyssa Stewart, who's our Chief Impact Officer for the United Way of South Central Michigan. And she's going to take an opportunity to go a little bit deeper in today's conversation. Alyssa?
Thank you, Chris, and good afternoon, everyone. As Chris said, I have the great privilege of serving as the Chief Impact Officer for the United Way of South Central Michigan. And in my role, I get to collaborate with knowledgeable teams in each of our local communities, Jackson, Capital Area, and Battle Creek and Kalamazoo, to deliver direct service to ALICE households through programs and to partner with over 100 nonprofits across the region who provide critical supports to our community. Before we dive into the new data focused on children and individuals with disabilities, we want to make sure everyone in the virtual room here knows who ALICE is. So ALICE is an acronym for Asset Limited, Income Constrained, and Employed. ALICE is a report, and it's an acronym that helps us understand an important and overlooked group of folks in our community, the hardworking residents who, despite working 1 or sometimes 2 or 3 jobs, are not able to consistently afford the cost of basic necessities like housing, childcare, transportation, and more. ALICE households are above the federal poverty line, but below the ALICE threshold established by the ALICE report, which means that the actual cost of living in their county is out of reach. This means that ALICE is not able to save and are often one emergency away from a dire situation. There is no business, neighborhood, or facet of our community where Alice is not present. Alice is in the room today. Through a partnership with Rutgers University and the Michigan Association of United Ways, we have been able to produce 4 Alice reports for the state of Michigan. The most recent is part of the source of the data that we'll talk about today. These reports are unique in utilizing a strong methodology coupled with input from data experts from across our region to create localized county by county data. And so we'll talk a bit about Alice in Michigan. As I mentioned, the last comprehensive Alice report for Michigan came out in 2021. Because of the delay in data and processing and how data collection works, this is data from 2019. So it's important to frame our conversation today with that knowledge, that this data essentially is telling us the story of our economic situation as a community heading into the COVID-19 pandemic. So you'll see some of the key findings on the slides. 38% of all households in Michigan are below the Alice threshold. So that includes that Alice population and also those living below the federal poverty line. Michiganders in poverty remained relatively flat at 13%, but Alice households were trending upwards from 19% to 25%. And the cost of living is increasing at a higher rate for Alice households versus our overall inflation measures. There are also huge disparities across race, age, gender, and household makeup. So you can see those highlighted on the screen as well. 48% of our Hispanic and Latinx households fall below the Alice threshold, and over 60% of Black households. 66% of households headed by those under 25 years of age are living below the Alice threshold. And 73% of single, female-led households are below the Alice threshold, with the majority of those below the federal poverty line. And now we're going to drill down to our region. So our new 6-county region that Chris talked about, will be highlighting more in depth. And so you can see that on the slide, that there are similarities and differences across our new expanded geographical footprint. So you can see in Eaton County, there's 31% of the population in that Alice category, 6% below the federal poverty line, and 71% above the Alice threshold. So in a relative place of financial stability. Of note, as we look at all of this data, it's important to know that the report tells us that of those shown above the Alice threshold, it's estimated that 10% of those people are on the cusp. They are on the brink. They are over the Alice threshold, but just barely. And so they are at risk with one unexpected circumstance, one layoff. They have the potential of falling back into the Alice category. So it's important to keep in mind as we look at these numbers. In Kalamazoo County, 24% of our households are in that Alice category, 16% in poverty, and 51% above the Alice threshold. In Calhoun County, 26% are Alice, 13% are in poverty, and 61% are above the Alice threshold. In Clinton County, 21% are Alice, 9% living below the federal poverty line, and 70% above the Alice threshold. In Ingham County, 27% are Alice, 15% in poverty, and 58% above the Alice threshold. Jackson County, 21% Alice, 16% poverty, and 51% above the Alice threshold. So as you can see, there's a significant range, ranges from 30 to 42% below the Alice threshold, and the subset of those in poverty varying as well from 6 to 16%, so a pretty broad range. It is important to note that we expect the COVID-19 and ongoing economic challenges that we're all experiencing will result in an increase in the number of households below the Alice threshold in the next report. Another valuable part of the full Alice report is that it provides information at the township and city level as well. So on the next slide, we'll look at the lowest and highest for those sub areas. Oh, we might have gone one slide ahead. Perfect, thank you. So you can see here the highs and lows within each county. And I won't focus in on these, but it's important to note that there is no subset of any of our counties that does not have ALIS. Again, poverty and ALIS are present in every corner of our communities, but you can see the range is significant. And there are lots of reasons for this. There's historical segregation. There's the unique facets and challenges of rural poverty, and then also of urban poverty and economic mobility as well. But you can see the communities highlighted here in each county that have the highest number of households below the ALIS threshold and the lowest number of households below the ALIS threshold. Okay. So let's talk about the future for ALIS. The 2021 report told us that in 2019, more than half of all Michigan jobs were hourly. Only 25% of working adults had salaried full-time jobs. These hourly jobs are most at risk due to increased automation, the rise of the gig economy, and a lot of the jobs that are hiring in that space tend to be lower wage jobs, which the ALIS methodology defines lower wage jobs as jobs below $20 an hour. Practically, hourly jobs also just create a little more volatility for households. They don't have the stability and guaranteed income of a salaried job. And so there can be overtime, but there can also be slowdowns. And so there can be volatility in the monthly wages people see. There also can be limited access to paid time off and other dynamics that can make those jobs challenging for ALIS households in finding stability. As I noted, we'll have more of a sense in 2023 when we have the next ALIS report of the true, at least partial impact of COVID on ALIS households in our communities. So that's a lot of information, but it's important that we all have a basic understanding of ALIS's impact on our communities. These are real people who play a crucial role in our everyday life. And of note is that ALIS is United Way's most significant driver. We are striving to center ALIS in our community impact work, in the investments we make with generous donor and corporate donations, in the collaboratives we participate in, and in the direct service programming that we offer, like the VITA program in some of our counties, or that we partner with other fun folks to do in our other counties. This year, United for ALIS and our ALIS collaborative is presenting two new drill downs into this data. They're called ALIS in Focus, and they dive much deeper into key groups. We've had two reports released so far this year, one on children and one focused on individuals with disabilities. Later this year, the third ALIS in Focus report will look at veterans. So we're going to start with a look at the ALIS in Focus on people with disabilities. That report was just released last month in partnership with local centers for independent living. And speaking of that, I'm excited to announce and introduce you all to the fearless leader of our local Center for Independent Living, Yvonne Fleener, who leads Disability Network. And I know we have a lot of Disability Network's awesome team on the call today as well. So I'm excited to turn it over to Yvonne to share more about the focused report.
All right, thank you so much, Alyssa. It's similar to what Alyssa said, there's so much data packed into this report, so I'm going to try to break it down and summarize some of it for you. But before I start, I am Yvonne Fleener. I'm the CEO of the Disability Network, Southwest Michigan. And I want to tell you a little bit about the Disability Network. We are designated under federal law to provide services, community education, and advocacy to people with disabilities to help them enhance, maintain their independent living. One of the things that's really unique about a Center for Independent Living is that we are, through the federal law, mandated to be governed and run by people with disabilities. So over half of our team and over half of our board are people with disabilities. And that gives us that uniqueness that not only do we serve people with disabilities, but we also have lived experiences with disabilities, which only further enhances and strengthens our work that we do. In Michigan, there are 15 CILs that cover all 83 counties in Michigan. and we are known together as the Disability Network. So let's dive into some of this information. Okay, disability. What do we mean when we say disability? The definition of disability can be both broad and narrow. When we're talking about the legal definition of disability, such as through the Americans with Disabilities Act, that is a very broad definition versus a definition that might be used for eligibility for benefits or eligibility for special education. That definition tends to get much more narrow, and it's multifaceted, and there's a variety of definitions. The definition that Alice chose to use for this report is as follows. Does the person have challenges, ambulatory challenges, so walking, climbing stairs? Is there a cognitive disability, so significant challenges in making decisions, in memory? Is there a hearing or vision disability? And then they also included, does the person have difficulty with self-care or independent living? So that might be dressing, bathing yourself, independent living, looking at, can you do things alone? Can you run errands alone? Or do you have to have a support person with you? And from that data, from that definition, they determined that there are 1.4 million people with disabilities in Michigan. And before we dive in, if you can go back for one more second, I'm going to just add one more caveat to that. There are people who are not in this report who are people with disabilities in Michigan. And when you read the report, there are a number of reasons why they were excluded. And it's people with disabilities who are incarcerated, who are living in congregate care facilities, group homes. They might live in college dorms, be in the military. There's a variety of people, even some people who are houseless or homeless were not included. And if you can imagine, when we look at that data, if those people were added, that certainly would have increased the numbers even more dramatically than what I'm about to show you. So to start, there are 48% of Michiganders live below the ALICE threshold. And of those 48%, 19% are below the federal poverty level. When we look at workforce, there are 3 times as many people with disabilities who are not in the workforce, so they're not actively seeking work. And there are 2 times the number of people who are unemployed who are actively seeking work compared to people without disabilities. For people with disabilities who are working full-time, there are 21% of them are still at the ALICE threshold, which means they're working full-time and they still aren't able to make ends meet. Similarly, looking at education levels for people with disabilities who have associate's degrees or bachelor's degrees, they are still at the ALICE threshold by almost double people without disabilities who have similar degrees. I'll say that one more time because it's a mouthful. For people who have associate's and bachelor's degree, people with disabilities are twice as likely to be at the ALICE threshold as people without disabilities who have the same degree. As you can imagine, children are the highest number percentage of people below the ALICE threshold. That makes sense. 1, because they're children. 2, the ability of their parents their earning potential is limited because they have additional needs with their child with a disability that other families don't have. The cost of the resources they need, the caregiving that they have to provide can limit their ability to work full-time or perhaps accept promotions and career changes that others are able to accept. And also, Alyssa mentioned this too, but continued racism and discrimination and system barriers that we see in Michigan and elsewhere, you'll see that the numbers for people of color are even higher for being in the ALICE threshold. So if you remember when we started, 48% of people with disabilities in Michigan were at the ALICE threshold. When you intersect that with race and ethnicity, those numbers get substantially higher, 65% for Black people, 62% for American Indians, and then 54% for the Hispanic community. So again, adding that component compounds the challenges. Okay, so in our region, and this is a similar chart that Alyssa showed you, we have almost 60,000 people in our region. 43% are living below the ALICE threshold. And you can see, I won't read them to you now, but you can see that for each of these counties. And in our region, through the ALICE definition, there are 138,000 people with disabilities living in our region. So 43% of them are below the ALICE threshold. And of that, 59,000 and change, almost half are below the federal poverty level. You can go ahead and move forward. There we go. So some additional barriers for people with disabilities in this report. As we all know, there's a regional, state, national housing crisis. That challenge gets even worse for people with disabilities. They're facing additional issues. So the affordability is problematic, discrimination, and then accessibility. The ability to find a home that's both affordable and accessible in our communities is very, very difficult. The most people, 53%, rent rather than own, and that's for a number of reasons that I'll get to in a minute. And about 35% of a person with a disability's income is going to rent or mortgage. So as you can imagine, at that percent of income going to rent or mortgage, people with disabilities are at risk of losing housing or having unstable housing, which then puts them at risk to lose their independence, perhaps have to go to more segregated settings such as a group home or a nursing home. And as we know, COVID has been hard on all of us. And as you can imagine, it's been even harder for people with disabilities. People with disabilities were twice as likely to lose their job during COVID. When you look at interrupted learning, and for those of you on the call who have children, you know that teaching and learning from home had a lot of challenges. So if you add the support that children with special education needs have, that they aren't getting when they're at home versus in their schools, compounded with technology, online learning, their learning was certainly disrupted during COVID. Anxiety and depression, all of us can relate to that during this pandemic, I'm sure. People with disabilities were 4 times as likely to report anxiety and depression. Go ahead and go to the next slide. On top of that, when we talk about employment, there's something called the benefits cliff. So people with disabilities need benefits, the public benefits, such as subsidized housing, subsidized food, Social Security income, in order to remain independent. So when they work, there's that balance of I can't work too much and I can't earn too much, because if I do, I will lose these benefits that I really need to maintain my independence. And I don't make enough money, even full time, to just forego my benefits. So that's something that people with disabilities are challenged with on top of everything else. The Disability Network has benefits planners. So we work every day with people who need assistance in that area and how to navigate that and make that transition. Go ahead and go to the next slide. Okay, we learned a lot today. Some of the, when we talk about employment for people with disabilities, there are some additional barriers, some of which we already talked about. There's still discrimination. There's still accessibility issues, transportation challenges, which could be lack of accessibility, affordability, or lack of public transportation in those communities. Lack of direct care workers. People with disabilities, many need direct care workers to assist them with daily living and to be able to get to and from their work. But as you, I'm sure, heard in the media, we have a dramatic lack of direct care workers right now. And then the benefits cliff that I just talked about, the income and asset limits. One quick thing I want to say about that is if you're an individual with a disability, you can have up to $2,000 in assets before you lose your benefits. So $2,000 or you lose your benefits. So you can imagine trying to gain wealth or just keep your head above water without losing your benefits becomes almost impossible. And that number has not changed in almost 40 years. Go ahead and go to the next slide. Okay, so that was not great news, but let's leave with something a little more positive. People with disabilities want what everybody wants, right? They want connection, meaning, inclusion, belonging. They want an accessible community. That's something that all of us want and can relate to. And all of us at some point in our lives are going to be touched by disability. Some people are born with disability, some acquire them later in life through an accident or some other type of disability that they've acquired. And through the aging process, the Alice report found that 33% of people with disabilities in Michigan are people over the age of 65. So all of us at some point in our lives, like it or not, are going to age and perhaps encounter disability for ourselves or for others. Disability, rather than looking at disability as a deficit, if we can change our mindset and start thinking about disability as diversity and value what disability brings to our communities, we can continue to grow our communities into inclusive and accessible settings for everybody. And you may be asking, what can I do to get involved? How can I be an ally to the disability community? And by being here today, that's certainly a great step for that. And the United Way has partnered with the Disability Network, and we are currently doing what's called the 21-day Disability Equity Challenge. There is a link on the next slide that will show you, so that shows you at the bottom where you can go, and that is a great way to learn all kinds of different topics in the disability community. Each day you get an email. Each of those emails includes additional information that you can deep dive into, watch videos, have additional readings to learn more about the disability community. So a lot to cover. There's so much more that we could have gone into, but this is certainly a great start. And I want to thank the United Way for your continued commitment to people with disabilities. We value your partnership so very much. And with that, I'm going to turn it back to Alyssa to talk about children.
Thank you. Yes, I'm back to talk about the other Alice in Focus report focused on children, a topic that I hope we all love to discuss and think about. We all love children, the children in our lives, the children in our community. So we know that the children data is especially powerful as we think about our community's future in the children that live here. So this data came out in April, so we've had a little bit more time to digest it. So we're excited to give you some details today. So as you'll see on the screen, we have, again, some statewide data here highlighted for you. So the Alice in Focus report focused on children really drills down into Alice households with children under the age of 18. And so you can see here that 44% of children live below the Alice threshold, including 17% in poverty, which is higher than the average for Alice households at large in Michigan. 23% of children with 2 adults working in their household still live below the Alice threshold. So just being employed, even full-time, even having 2 incomes is not enough based on our current economy to protect kids from living below the Alice threshold and still being in a household that's struggling to make ends meet every month. 62% of children with a disability live below the Alice threshold, and highlighting that intersectionality between these subpopulations. And again, highlighting racial disparities, 71% of Black children live below the Alice threshold in Michigan, compared to just 36% of white children. You can see here again all of our 6 counties highlighted. I will just note, you may have noticed this in the other pieces, but for the Alice in Focus data, they actually use what are called PUMS data, P-U-M-S, public use microdata, that has to group things together by groups of 100,000 people. And so you can see that Calhoun and Berry counties are actually grouped together for these reports. So I did just want to note that it includes Berry County in this data, but Berry County is not part of our footprint, but is served by another local United Way. You can see here the rates for children, and they fluctuate quite a bit across our footprint for children. You can see Clinton and Eaton counties has a pretty low, or relatively low rate. So only 26% of children are living below the ALICE threshold. Kalamazoo County is 48%, Calhoun and Berry at 33%, Jackson at 39%, and Ingham County at 50%. Overall, 39% or 231,000 children living below the ALICE threshold. So with that, as we said, whenever we talk about ALICE, we always want to talk about and dig into the different demographic data. And so you can see here some of the disparities for our localized data. So it is similar to the state in having significant disparities. So in our region, 73% of Black children are living below the ALICE threshold, 68% of our Hispanic and Latinx children, 41% of our Asian children, and 43% of our households, of our children in households that identify as multiracial. So housing is also a big issue for this group. We know that stable housing is a big concern because children benefit greatly from stability in their housing. Emotionally, having that stability, but also educationally. This stability allows them to stay in their school district and have a consistent learning experience instead of having to move around or miss school due to housing issues. ALICE households are in a bit of a vicious cycle when it comes to housing, as you can see from the data on this slide.
Come on in. You can pull a chair up if you want.
Oh, sorry, someone's unmuted. Because they're not making enough, they're rent burdened, which puts them at risk for housing loss, which can then disrupt their ability to maintain employment. So you can also see that access to benefits is a challenge for children in our community as well. And some of these are pretty alarming. So 66% of children below the ALICE threshold don't receive SNAP benefits. SNAP are food stamp benefits, are what some people call those. So access to the ability for parents and households to purchase fresh fruits and vegetables and food for their families. That's a critical benefit and one that I think we all hope is going to the children who need it most. But 66% of those kids are not receiving SNAP benefits. And 33% of children below the ALICE threshold in our region don't receive medical assistance, so are not on public insurance. I will just say, because a natural question for the last slide is why. I think a lot of it is related to what Yvonne shared around benefits cliffs and complex application processes with stringent requirements, stigma for accessing benefits. That's a huge piece for folks in that ALICE population. They are working hard, and it can be very stigmatizing for those folks because of the way our systems are set up for those folks to access the resources that they might need. So the bottom line is that far more children are growing up in financial hardship than our communities realize. Where the high-level poverty rates are decreasing, these nuances still exist. There is still growth in ALICE households with children, and especially those huge disparities and different experiences for our Black and Brown neighbors. ALICE families are more likely to lack stable housing, quality childcare, private health insurance that gives them the choice of who their medical providers might be, and other basic necessities. And as I mentioned, and as I all think we inherently know, these lead to short and long-term consequences for children. So we shared a lot of data with you today, and we hope that this data helps us better understand the scope of the challenge, but also the opportunity that we have as a community. I often say when I'm talking about ALICE that we cannot heal or support what we don't see and what we don't acknowledge as a community. And for too long, ALICE has been unseen. Families and children and individuals have been struggling to make ends meet, and often, again, not having the space or support to talk about their challenges, and instead seeing it as maybe a personal failure What am I doing wrong? Why can't I make this work? I'm working so hard. And instead, taking this discussion to a systemic level. How is our community falling short for Alice? How are the systems, policies, processes, how are those falling short and maybe excluding Alice unintentionally? So those are the questions that we at United Way have been considering, along with partners like Disability Network. We're so glad to have you all here today to be a part of the conversation about how we could better support Alice in our community. So with that, I'll turn it over to Chris Sargent to launch us into question and answer.
Yeah, thank you, Alyssa and Yvonne, for sharing a lot of great information for us today. Again, we know it's a lot. You'll get the slides after today's meeting, so I'm sure that'll be helpful, as well as a link to how you can get to the Alice report to see more information, because this is just some high-level snapshot for you. There's a lot more detail actually right on down to the municipal level that I know a lot of us take advantage of. Now's the time that we want to open it up to all of you to ask questions, to offer thoughts and perspectives and experiences that you all have related to today's topic. There's a couple ways we can do that. First of all, feel free to use the chat. We'll be monitoring that and lifting that up, and I'll be working with my colleagues to help answer any questions that might exist. Or you can raise the virtual hand down at the bottom of your video screen. There's the opportunity to raise a hand, and we'll be able to call on you directly. So we got about 15 or so minutes to be able to do that before we wrap up today. So we'd invite anybody who's interested to share a perspective or ask a question now. I see Matt asked a question in the chat. Is there any data around graduation rates or post-secondary education attainment for youth that grow up in households below the ALICE threshold? Alyssa, you want to answer that?
Yeah, that's a great question, Matt. There is some data. It's mostly around their status, because the information isn't longitudinal at this point. So we're kind of seeing snapshots with the ALICE in focus. So we get a sense of current educational attainment at the time the data was collected, but not longitudinal. So we hope to continue to have this report be generated every 2 years for as long as we possibly can. And so our hope is over time, we'd be able to work with the data collection gurus over at Rutgers University to start to track some of that longitudinally. So we could understand more about the long-term trajectory of children who are growing up in the ALICE space. So not longitudinal yet that could give us that data, Matt, but hopefully down the road, that stuff we would be able to provide.
Great, thank you, Alyssa. Jose, I saw that you had raised your hand. If you want to come unmute, please feel free to do that.
Yeah, thanks for all this information. You're right, it's a lot of information, and it makes me wonder, there's so many different entry points then for these families. And this is probably gonna be naive, but have we tried wraparound services for some of these families?
Great question, Jose. I feel like it's happening in pockets. So we, as I mentioned, collaborate with over 100 great nonprofit organizations. And I feel like many have adopted wraparound case management models with the families they serve. But again, it's happening dependent on the households accessing service as part of the social service sector. And one of the challenges we see is that a lot of ALICE families don't engage with the social service sector, again, because one, they're so busy working, 1, 2, 3 jobs that they can't really access services, or again, they don't feel they should. They feel that they're doing okay, they're getting by, and they don't want to take those resources from other people who may be in a worse situation than them. So I think there are a lot of service providers trying to use more wraparound service models, but that requires there to be engagement of ALICE families in those programs.
Alyssa, and so on that one of the models that we have seen in Calhoun County is the early start, when they put the DHHS caseworker in the preschool environment. I don't remember if it's a he or she, but they were able to grab the families and have those conversations around what it takes for the kiddo to be successful in school. And if they needed to apply for social services, then it was happening right there and then. So then I think of some other experiences that I've seen in Kent County. And I was thinking, well, maybe I need to get a DHHS caseworker in our building at Voces, because then it would be specific. I mean, the majority of the folks that we serve are Latinx. So that would have a couple of touch points. In digging deeper, I was quoted about $60,000 is what it would take to have a DHHS caseworker in our office. And I'm thinking, well, that's not feasible. But I'm trying to help connect some of those dots, but it's not being reciprocated. Or maybe, they have their setup and systems, and I get it, but I'm just trying to think different.
Yeah, that's a good point though, Jose. And I'd be happy to talk with you offline because there is a cool model. There's a My Bridges. My Bridges is a system you can use to get access to all public benefits. And there is a way that we could get your staff, Jose, trained to help people access those benefits. So I'd be happy to talk about that offline. If anyone else has interest in learning more about My Bridges, feel free to drop in the chat and we can maybe pull together a conversation about what that could look like to get existing staff equipped to walk people through My Bridges. I see some great questions in the chat. Chris, are you transitioning to some of those?
Yeah, I'm going to do that now. So Andy Richards asked, you mentioned that Alice is one of United Way's biggest drivers. How are you prioritizing addressing resources that are falling short? Because with so many opportunities, it's got to be difficult to target limited resources. And Andy, you're exactly right on this. I might mention we're close to the start of this year's annual campaign. In fact, we'll do that very shortly. We raised $10 million in the region, and that happens by tens of thousands of donors participating in the annual campaign. That's going to be critical for us to continue to raise the resources to invest in the programs that Alyssa mentioned, our 100 plus partners that we work with across the region, and invest in their programs to support Alice families. I think from a big picture level too, we recognize that we can't do it all necessarily. Although organizationally, as Legacy United Ways and collectively, we've raised the most resources and generated the most financial resources ever in the last couple of years through the annual campaign, through federal and state dollars, ARPA, and other resources. And a majority of that investment has been around things like basic needs, food, housing, those areas to really focus on helping families ensure that they're not only above the poverty line, but also ideally above the ALICE threshold. So those are a couple of ways that this data has not only helped us, but quite frankly, has helped all of our nonprofit partners really understand where some of the greatest needs are and where some of the interventions can be most impactful. So that's how it allows us to focus with those limited resources. And we continue to look at all the ways that we can generate revenue to make larger and more scalable investments across the community. So thank you, Andy, for that question. Michelle, I see you offered some perspective as it relates to the earlier question around college access data. Did you want to share something now, or do you want to just mention maybe in the chat some resources that we can look at to connect to the ALICE data?
Thanks, Chris. I did connect with Matt directly, but all of the college access networks in our regions, so Kalamazoo, Battle Creek, Jackson, and then myself in Capital Area, we maintain a pretty robust dashboard and trends on exactly what Matt was looking for, the data on graduation and on post-secondary attainments for students, not only who might be low income, but also students with disabilities. So you can access that either through the College Access Network or directly on myschooldata.org. Thank you.
Great. Thank you, Michelle. Tahani, if I'm saying your name right, I'm going to save that question towards the end because I think that's a good segue. And Alyssa, I'll prep you. I'll come to you for some of that as the lead on all of our investments. Bill asked, is there any reason why this data is not collected more frequently than every 2 years? And how does it allow for adjustment to the federal poverty level?
Sure, I can answer that. Great question, Bill. Thank you. So one of the main reasons is the sources of the data that is compiled to put together the ALICE report. So the American Community Surveys and then several other data sources are synthesized for this data. And so we're on an every 2-year schedule because of those data sources and the cadence at which they are pulled. So we're a little bit dependent on those data sources. And so to your question about the federal poverty line, I hope I'm answering your question, but I'll answer it this way, that the federal poverty line is theoretically looked at every year and adjusted. The adjustments tend to be very, very small. And it's important to note that the federal poverty line is significantly different than the ALICE threshold. So for example, a one-person household, the federal poverty line is $12,400 or so in income. Someone making below that would be considered below the federal poverty line as a one-person household. The ALICE threshold for a single household is over $24,000. And again, that's based on the actual cost of living in our community for a very basic bare bones budget. And so it really highlights how inadequate the federal poverty line is. And yet the federal poverty line is used for eligibility criteria for all sorts of structures within our world. So we are absolutely advocating that the federal poverty line be looked at. We are asking folks to consider using the ALICE thresholds as eligibility criteria where they can versus the federal poverty line, because the federal poverty line is so inadequate. It's just such an inadequate measure of our current economic reality. And so that is something that we are advocating for.
Great. Thanks, Alyssa. I see there's a question in the chat as well about, do we know what the 2022 ALICE income level is relative to inflation? I think the simple answer is we don't know that yet. That'll be a part of the next report. We do know that that's a higher amount. That increases the level at which people would be below or above the ALICE threshold. So I think that's pretty obvious probably, but we don't know the specific detail on that. Love that so many of you are interested in your organizations and being a part of the resources through My Bridges. Obviously, the 211 system is a critical resource for that, as well as each of our additional partners. Yvonne, I want to come to you with this question. Does the Americans with Disabilities Act have any positive effect for ALICE people with disabilities? And is there any improvements you would recommend?
So the definition of ALICE is obviously more narrow than the ADA definition. The nice thing about, so those people are part, right? They're covered under the ADA, but the nice thing about the ADA definition is that it is very broad. So you can have a record of a disability, so a diagnosis of a disability, but you can also be regarded as having a disability. So that really opens up the number of people that are included. So you may wonder when you see statistics about the number of people in Michigan with disabilities, and you'll see that number, some people say it's over 2 million, right? And that's because they're using that broader definition. So that's one of the great things about the ADA, is that it is more inclusive. Yes, it has a positive impact because it the accommodations and the requirements of the ADA certainly impact this group too. The ADA, when you say the ADA or the Americans Disabilities Act, I think most people think about, ramps, curb cuts, which is great. But, we're 32 years in. We just celebrated the ADA anniversary, July 26th of this year. And there's still so much in the ADA that we really haven't pulled out and used for the benefit of all people with disabilities, ALICE or not. Some of those improvements, I think the things that I would talk about are things that we do at the Disability Network, which is helping people with disabilities in the workforce understand how to ask for accommodations. Having employers understand that accommodations doesn't always mean $5 signs, right? There are lots of ways to accommodate your workforce and create an inclusive environment that doesn't necessarily have to be expensive, but allows you to have a labor market that ultimately right now is an untapped labor market of people with disabilities. So There's a lot in there that's a lot more than just physical access that I think we need to really start honing in on and using more for the benefit of not just people with disabilities, but all communities. And the one thing I always say, sorry for the long answer, Chris, but
no, you're good.
And I think about this, like, how many times do you like leave the grocery store, right? You've got your hands full and you take your hip and you tap that accessible button, right? So that the door swings open. Or how many times you push your stroller down that curb cut. And so, or used an elevator. All of those things are a result of the ADA. They didn't exist barely before then. And so I think that the work of the ADA certainly benefits all of our communities. And so we need to continue to look at that as a tool to help create inclusive communities for everyone.
Thank you, Yvonne. I want to follow up with another question in the chat. It's pretty specific that I think Joy is asking about hiring more staff to address the crisis, and just recognizing that some of the data you shared, the ALICE data as it relates to people with disabilities and some of the need of support that might exist. How, when you think about the work of Disability Network and those of you in organizations that serve people with disabilities, could you give us a sense about how you're thinking about prioritizing and investing both resources and talent?
For us, we are actually, as an organization, going through our strategic planning and a little bit of a pivot from our focus in the past. And that is looking more at that systems work, right? I mean, we talked about that when we looked at the slide about people of color and the differences in the rates of being at the ALICE threshold in those communities. And those are systems barriers. And so the more we can break down that level of barrier, the more we can help all. We can help someone every single day, a new person with the same issue, but until we address that barrier, it's going to be hard. And I think that, this organization has done fantastic work long before I came here in that area. And I think there's more we can do. One of the ways we do it is through our community education. So I encourage people to check out our website and look at all of the free trainings that are coming up. Another way is working with local businesses and organizations to say, okay, you want to hire a person with a disability, or you want to look at that untapped workforce. Here are some things in your organization or business that you can do. Some of them are really simple and easy and not expensive that you can do to create an environment that allows for or creates accessibility to hire people with disabilities. So I think we're on the right track, but there's a lot more that we can do in the systems arena.
Yeah, thank you, Yvonne. I know there's others that have shared perspectives and additional questions that we didn't get to, but Alyssa, I am going to come back to that question of what's next, because I think that's a good one before I wrap today and get you all out of here before 5.
Absolutely. It's a big question, and one that no one organization has all the answers to, right? It's going to take all of us bringing our piece of the puzzle to the table. And so I'd answer that in a couple ways. One would be, I think it's important for us to each individually reflect on this information, on the ALICE information at large, on the individuals with disabilities, individuals with children, in focus reports, and really think about the ALICEs in our lives. Who are our family, our friends, our coworkers, who may be in these situations? How do we open our minds to the fact that people who, again, we work alongside may be in these situations, and they may not be who we picture when we think about people who are struggling? How do we open our minds to that? And how do we create systems, processes, and procedures within our scopes of influence? We have all kinds of powerful, brilliant people on this call today who also have networks of powerful, brilliant people. And we all have spheres of influence, again, in our personal lives and in our professional lives, or all the facets of our lives. So what are the things we can control that we could make better for ALICE households? especially paying attention to the intersectionality that we've highlighted today, where really thinking about the folks that are most likely to be below that ALICE threshold, and how can we, within our spheres of influence, make changes. So I think that's one big piece, is that individual self-reflection. And then it's getting to that systems work. So it's thinking about the systems that we are a part of, and the policies. As Yvonne just said, a lot of this work is dictated by really big systems, by the government, by housing systems, by the employment and labor market, just really big things that are hard to wrap your arms around, but that need to be changed and improved, because they're clearly not working well for everyone in our community, and that could be improved. And so I think the other thing is thinking about advocacy and public policy. And that's something that United Way has been trying to focus in on as we focus on ALICE. But it's something that, again, will take collective will amongst all of us to rally for these changes. So changes in housing policy, changes in benefits, employment, things like thinking about minimum wage and those pieces. Those are all parts of this equation that have to fall into place for us to see real, meaningful, and sustainable change for ALICE households. So by joining us in things like our equity challenges and other pieces, we're starting to build that will, that shared will and understanding of these issues, so that we can come together and build a group of like-minded people with that will to change. And we'll start activating those groups around certain public policies and other pieces that we know are bipartisan, are common sense, and that will meaningfully impact ALICE households. And so we invite you to join that. Even you being here today, we have your email. We won't spam you, but we now know that you care about ALICE, and we'll make sure to keep you informed about the work that we're doing to support ALICE. As Chris mentioned, your financial gifts matter, your collaboration matters, and your thought partnership matters as well. Is there anything that you all would add, Chris, Yvonne, anything you would add to that really big question of, now that you know this, what's next?
I thought what you said was right on point.
Great. Well, thank you to my colleague Alyssa for joining me today. Special thanks to Yvonne, to you, to your team, your partnership at Disability Network, and so many of our nonprofit partners who are on today, who are a part of this journey with us in supporting children and families that live below the ALICE threshold, that are working hard to try to make ends meet. I did put in the chat email addresses for all three of us as speakers today, so please feel free, if you have any additional thoughts or questions or perspectives, to reach out. I think one of the things that you heard from us today, and I would just reinforce, we aren't just talking, those numbers, behind every one of those numbers are people. They're families right here in our community, right here across our region and the 6 counties that we serve. I got a call late yesterday from a local business owner. I know we have a number of our business partners on today, who said, I've got a great employee who's been with me for a number of months. I'm so excited how much they've added to the talent of our team. And I just found out that I think they're about to get evicted. What do I do? And so we offered 211 as a resource. I talked to them about some of our partners that might be able to help intervene. But I also asked the question, well, what's their compensation and benefits that you offer them? And they said, well, we're working hard to increase our wages, and they have been. But they also shared a number that I said, if you looked at the ALICE data, you'd see pretty quickly that that single mom with 3 kids is going to struggle on a monthly basis to make ends meet. And can I ask you what your rate of scale pay is over time? And they said, well, they're almost at a level of time with us that they could make a couple of dollars more an hour. And I was like, don't make them wait. Pay them now. We sometimes have this idea that we want people to start with us and see how they do before we pay them sustainable wages and benefits. Let's start them there so that we can remove the barriers from the beginning for them to be successful as employees and contributing members of our community that we so appreciate and care about. I thank you all for attending today. I know we're at 5 o'clock. Again, you'll get the slides. This has been recorded, so if you want to go back and review it, share it with your networks, please feel free to do that. It will be available soon on our website. And I just want to say thank you, everybody, for attending and being with us today. Have a great rest of your day and evening. Be well.